All right, ladies and gentlemen, it's a brand new episode of Doctor in the House, and we are going to be having a continuation of the topic that we started last week, which is the nose and paranasal sinuses. We learned a lot, and you sent a lot of questions, which we'll still be going through, especially for the questions that we couldn't go through last week. We will get to answer it on the show. But if you have more questions about your nose and paranasal sinuses, especially as we learn along, you can send the questions via the WhatsApp number on the screen. And obviously, I'm sure you're wondering, who is the doctor in the house today? It's no other person than Brigadier General Dr. Ni Obodai, who is an ENT surgeon and former commander at the 37 Military Hospital, and now a medical director of Roseburg ENT Clinic at East Legon here in Accra. You're welcome, sir.
Thank you very much.
How are you?
Doing good.
Yeah. So, oh, you didn't bring our little friend today.
Oh, yes. I gave him a day off.
Oh, he's okay. I get it. I get it. All right. So we are still talking about our nose and paranasal issues. So before we get into it, before we continue, or let's say before we get into the part two, we have some questions from last week. So this person says, I had experienced runny nose continuously for about 10 years. I would be okay for like 2 weeks and it relapses. I used this immune booster called Miracell, and that did the magic for me.
Okay.
It's a comment.
Once you have, a good formula, that's fine.
Mm-hmm.
Yeah,
but can someone be running? Can someone have like continuous running nose for 10 years?
Yeah, it can. It may be on and off. I can. But before I push on, let me just add more voice to the sentiments of the nation in our mourning state. Yeah. And send my condolences and heartfelt, situations to the families. Okay. The ministries, the appointees, the officers and men of the armed forces, particularly the Ghana Air Force. Condolences and big salute to them.
Yes.
Very well. So concerning the runny nose, you can have it for a period of time if what is causing the thing is there with you, present with you regularly. Okay, if it's an allergic situation, whether seasonal or perennial, if you're in contact with that situation, you will keep having the symptoms. So it's very unlikely. It's very likely you can have that situation running. Okay. Now, if he has Miracell, what he says, an immune booster, which is taking care of the issue, if it's not broken, you don't fix it. So then that's good enough for him.
So let me ask a question based on what he said about the immune booster. Do you think there are immune boosters or, say, pills that can actually help?
I'm hearing it for the first time. I haven't used any boosters to treat anybody's allergic rhinitis. Okay, so I don't know how he arrives at that.
So this
whether
is
he's actually been tested.
Yeah,
it's a rhinitis.
Yeah, rhinitis because it's a runny nose.
Exactly.
Yeah,
You got it.
Yes,
you got it.
I'm a good student. All right, so we have another one. Hello, Doc and Chris. My sense of smell has drastically reduced. I have been asked to use oregano oil, but by the ENT specialist, but it still persists. Please help me. Wow. You know the sense of smell thing? I never knew it was a thing until during the COVID pandemic.
Exactly.
I actually lost my sense of smell.
For a lot of people, that was the main symptom.
Yeah.
Okay. We didn't even mention that. We didn't mention anything. I intended to go into that direction today about the sense of smell. You can't lose your sense of smell. You have experienced that partially or totally. Okay. Now, what is the cause? I keep saying that all the time. What is the cause? If it's an obstructive thing, you have polyps that have filled your nose is running, the mucosa is so engorged, and the stimulus doesn't even go through the nasal passages to reach the point where the exchange takes place. Yeah. Temporarily, you have a loss of smell.
Right.
Okay. If you get a virulent virus that destroys the cribriform plate, the level where the exchange takes place, again, it's scarred. Yeah. So the exchange doesn't take place well. You either have partial or total loss. If you get a trauma, RTA, fight, anything, and you get a hit right in the forehead, you still have a problem because the the olfactory lobe is lying right in the frontal,
Right.
under the frontal lobe, right under the forehead, on the forehead. So what is the cause of the loss of smell? Is it a hypo, which is a partial, or anosmia, total loss?
Right.
Okay? So what is using there? Usually you want to find out what it is. If it is obstructive, surgically clear up the passages, and you're free. If it's the healing of the plate, the mucosa of the plate, get some steroids in there, all right. And then if it's trauma, you have to do reposition, and the nerve can get a shock.
Right. So would you say it's, okay, how would you describe the one that happened during COVID?
I want to have during COVID, it's a virus thing.
Okay.
So it affects
So it's
the
viral,
plate.
yeah.
Yes, it's viral. It affects the plate there where the exchange of the gases take place. So once that area is scarred, it affects the sense of smell, and then you lose it.
Yeah, and you mentioned something, polyps.
You can have nasal polyps
Yeah,
that will fill the cavity.
What is nasal polyps? Can you share with us how they form and what are
Nasal polyps are glassy, kind of translucent masses that fill the nasal cavity as a response to some of these allergic irritations that you have in the mucosa.
Can we
and
see
comes
it
typical,
if somebody bends down?
Oh yes, if it's huge, you can see it, glassy. If you shine light through it, you can see it through it. It's not a full mass. It's a glassy kind of mass, transparent. Okay,
In the nose.
and if it's in the nose, it could really push up, protrude to the outer spaces.
It can come out of the outer space.
Yes, my dear.
And it's called polyps.
They're nasal polyps. And it can so fill the canal, you cannot breathe through the nasal cavity at all because it's full. No air goes through. If it's bilateral, you only have to breathe through your mouth.
And how is that cured?
If it doesn't shrink by medications, you have to go surgically and get it out.
Ooh.
So you got to do nasal polypectomy, go in there, remove the polyps, get the nasal passages free once again. Then you can have gaseous exchange. Then you can smell. Because, you see, the sense of smell, we played down on it for a while. I enjoy my coffee before I even taste it. Because you smell it.
I enjoy my wine before tasting it.
Okay, there we go. So you smell it,
So
and then
I was
it
very
adds onto
paranoid
it.
when I couldn't smell.
When you couldn't smell, yeah.
During COVID. I was so paranoid.
You enter the room, you smell the food, oh God, before
Yeah.
you even sit at it. So the sense of smell is so important, and it only happens
So
through
would you
the
say
nose.
smell also affects taste?
Smell affects taste, let's like I said, not directly, but then, like I said, it aids the taste because you have smelled and then you get the taste. Some of the nervous linings go through the same taste and then comes through the, the secretion as well. So they're related.
All right. So since we're talking about the nose, right?
Yes, ma'am.
I've heard about something called a deviated septum.
Wow, that's cool.
Yeah. So what is a deviated septum?
That's cool.
And I actually heard, first of all, the word septum was because I like piercings. So the septum piercing. And then someone was like, oh, okay, do you know there's actually a condition called a deviated septum that happens in the nose? I'm like, what is it? Yeah.
Okay, there we go. I'm sorry I didn't bring Jack. I would have just showed you what exactly it. Now, the nasal cavities are split right through the midline into two. So that partition in the middle is the nasal septum.
Yeah. Okay, so like the partitioning in the middle.
If you picked it up right there, that division.
Yeah.
Okay, the line or the mark that divides the two cavities in the nasal, anterior nasal nerve is the septum. Okay, so if you touch the left, you cannot go through the right.
Right.
Because the septum
there's a blockage
is the limiting
here.
area. Exactly. That is the septum. The anterior part of it is cartilage. That's where people want to pierce.
Yeah.
The vestibule is even skin. The anterior part of it is cartilage, but the posterior part is bone. So if I brought Jack, you'd have seen the bony septum, vomer at the back of it. But the anterior part is septum.
Yeah.
So that breaks away. So that is the septum. The people who get accidents in fights and all that, and you get a fractured nose, it could fracture or deviate your septum as well.
Oh, is that why, like, say someone gets an accident or maybe get blown on the face?
Hit.
Yes, the nose can.
The nose can shift.
It can shift.
Yes, immediately is the nasal bones that are fractured.
Yeah.
But it may also affect the septum. The septum can actually fracture,
And
which has to be repositioned. surgically.
Okay, surgically.
Yes,
Okay.
ma'am.
I was,
Well, you
I was
could-
going
you
to
could-
ask something because, you know, in movies, especially in movies, when you see someone's nose is shifty, like you just see...
It just pushes it back.
And the person screams, "Ow!"
Yeah.
But it gets
You
straight.
could
Yeah.
temporarily...
Can you do that
You
with
could
your hand?
temporarily, yes, just push it back in place.
Ooh,
It's
it'll be
painful,
painful.
certainly. You could push it back in place, but then permanently, you'll have to actually reposition it surgically. Make sure it's back in line, and then cast it, because it's a bone.
So how important is that bone being straight to the face?
Well, if you mind what your face looks like, it's important to have a straight nose.
Okay, okay.
And it was made straight, actually. Because if your nose is crooked and it's shifted and you don't mind and you're okay with it, people will be pointing to your nose right through the town. Hey, what's
Right.
going on? What's going on?
Right.
So it's important to reposition it so it doesn't affect the lower portions, for example, the septum, and come back again and affect breathing. You can have a septum deviation after trauma,
Yeah.
which occludes one whole cavity.
All the way.
The septum is so fractured or deviated, coming back to the original point.
Yeah.
So deviated, it reduces the airflow from that side.
Right. So now let's
Okay.
talk about septum piercings. Do they actually affect the...
Well, the septum piercing is more in the vestibule.
Right.
Okay, and that is
So that's the cartilage side, right?
even the skin before the cartilage.
All right.
You're not even piercing through the
Oh,
cartilage.
okay.
Now, it's just
I
the
get it.
skin in front. That's the vestibule. So you're not actually going through the cartilage. You go through the
right.
skin.
Okay.
Now, when they pierce the ears,
They go with... the
here at the normal
Is the
point, the
skin?
lobule, that's skin.
Yeah.
But when they pierce all line here, they go
That's
through
the
the cartilage.
cartilage, yeah.
And some get reactions from the hypertrophied scars, and they get keloids hanging behind
Yes,
the
I
ear.
know they get keloids. Yeah.
You know, so in that case, you go through the cartilage.
So
on
you
top
can also
here.
get keloids on your nose. Is that what you're saying?
It's a skin condition. So wherever you have skin, if you have hypertrophied skin scar, you can get a keloid.
Right.
So
Okay.
then, to answer that straight away, it's typically in the vestibule where it's skin in the nose there. They don't go to the cartilage, I mean to the
And it
cartilaginous
doesn't
part of
cause
it.
any harm.
No.
All right. Okay. So
If
aesthetically,
you're fine with it,
yeah. Aesthetically, you can look like a cute cow if you want it.
there you go.
Whoa. Anyway, we have some questions here. Good morning, doctor. Please, I have not been able to detect scent for more than years now. I can only feel unpleasant about the air I inhale, but I won't be able to determine the scent I'm experiencing.
Yeah, you can have a condition like that.
And what, like, so what do you do?
If the sense of smell is so distorted, okay, you can
Oh, okay.
you can smell tea and think it's cooking oil. It's a messed up system. Call it cacosmia. I mean, you're smelling the
Cacosmia.
wrong thing.
Yeah.
All
So
right.
what do you do? How
Yeah, you
does
still
that-
have to go back to the same treatment as if you have a hyposmia or have an anosmia and still treat it depending on the basis. If you check and it's obstructions or the nerve is messed up, you got a shock of the olfactory nerve and temporarily went into, distortion, you can smell things wrongly.
Yeah.
It can happen.
So, Doc,
But importantly,
Yeah.
for this reason, smell we're talking about, it's so important in our homes. Okay, for 70,
reasons,
80%
yeah.
of people cooking with gas. So important. If you got into your kitchen and the gas is leaking and you can't even
and you
smell
can't smell
it,
there's a problem.
you are going to get in trouble. Okay, so it's also very important to get to know and find out what's going on. If you're smelling things wrongly, hey, let's examine it, find out what it is, put you on some treatment and get it back.
Right. Doc, so I have a question. Because
listening.
we keep talking about, go back, go to
Get
your
to the
hospital,
doctor.
and then probably we do a surgery and all that. And I have a very photographic memory, and I like to imagine things.
I hear
so
you.
when you talk about surgery, how is the opening? Like, are they opening from the front? Are they opening from
Which
the...
surgery are you referring to?
In nasal, like all the surgeries that you're talking about. Or does it go from under? Like,
Okay.
is there a
For-
particular
for-
way that it's done?
Yeah, for most of them, we're not doing any external incisions at all.
Okay.
For most of them, they are done intranasally.
So
Intranasally
what does
meaning,
that mean?
intranasally meaning we put you to sleep, okay? Get the nasal passages open. We can see, we have scopes, very thin scopes, fine scopes that can go right through the nasal cavity. So we see it, do it intranasally. We hardly give you scars outside.
Okay.
Unless you're doing other structures like mucocil, where you have to actually cut open and expose the forehead so you can drill into the frontal sinus, then you get scars. But we do it so nicely, right along the brow. So after you've done it, you closed it, you might not even see you have a scar. So most of them are done intranasally.
Right.
Septum, plastic, nasal polypectomy, cautery. Nose bleeding, you have to do cautery. You come in, you're all done nasally, intranasally. So for most of them, we don't give you external incisions at all.
All right, all right. So this one says, good morning, doctor. Most times I feel something itching in my nose cavity and it generates in my ear. I have to produce some sounds in there and scratch in there. I'm sure it's a...
There, that's the thing.
What could be the cause
grunting
and
kind of
remedy to the condition, and what kind of condition is it?
Yeah, I'll throw it back at the patient. I mean, back at the questioner, because a lot of them, typically allergies, is the patient who should identify what exactly is giving him or her the trouble.
Yeah.
Okay, so it's a question of being a little careful. Find out what you're exposed to, your immediate environment. What is it that makes my nose itch, makes it run, or I sneeze? 3 signs. Immediately you know you're reacting to something.
Right.
Okay, so it's important to just be a little careful. Find out what's going on in your immediate environment, and then you can be able to put a finger on it. As a matter of fact, if you're able to put a finger on the irritant,
then you're free.
And you're able to cut it out, your problems are solved.
All right, so good morning, doctor. I have a problem. I get serious running nose almost any time I am eating. It can sometimes be embarrassing. Could it be medical? And this person's Sampe. Sampe is asking if it could be medical. Well, if you ask me...
It is.
No, if you ask me from a layman view, I'm a business pepper.
Yeah, so what are you eating?
Pepper. When you eat hot pepper, you do...
Yeah, you will run, and then the capsicum will just irritate the passages and everything. So some people think it's okay, cleanse the sinuses because your nose is running, your eyes are tearing up kind of thing. Hot pepper, all right?
But what if it's not pepper? Could it be something else?
Yeah, so I want to find out what he's eating. Okay,
Right.
is it something particular or anything he eats at all?
Okay.
Okay, so it's important to actually find out what is it.
What are you
like
eating?
you're saying, if it's pepper, if it's some particular spice,
Yeah.
then you know you're getting trouble with it.
Okay.
Even just by smelling it, irritates the nasal mucosa, boom, it starts running, you're reacting.
Right. So,
what is
doctor,
it?
are you trying to tell us that it's not normal? It shouldn't be normal for us to see it as normal when you eat a lot of spicy food and then you have runny nose?
If you eat hot pepper, your nose runs, I'm not admitting you for anything at all.
Okay.
Yeah, temporarily, your nose runs, finish eating, end of
that's
story.
it. All right.
It dries up.
Yeah. So it cannot cause anything more serious than that.
It's a temporary thing.
Okay. All right. So good morning, doctor. Please, whenever my husband is eating, he has runny nose.
Lord.
We just talked about this.
Is it gonna stop him from eating or what?
Now, good morning, doctor.
Oh my God.
My son has breathing issues. Always rubs his nose. More times breathes hard, and it's difficult to throw out phlegms. This has been with him more than a year, and this is Chrisman from Bush Road.
Same allergy.
Allergies.
If it's
rubbing the nose.
rubbing, grunting kind of thing, it's still allergy. As a matter of fact, if you're breathing, if you haven't done anything like running up the stairs or anything, and you're breathing and somebody is hearing you, then your breathing is becoming labored.
Right.
Okay, because breathing, if I sit down quietly and breathe, you don't hear me breathing. All right. But if you're breathing, the nasal is opening up, flaring, that means that the breathing is labored.
All right. So this one says, Doctor, I have been experiencing bad breath and it's worrying. I need help, please. And also, talking about bad breath again, someone also said, I am Henry Fayo from Ashale-Bochwe. I have been getting running nose and sometimes blocked nose for about 15 years. And I do...
15?
Yep. And I do experience foul smell coming out from my nose. So, bad breath and foul smell.
Yeah.
What's
all right.
that?
The runny nose, I think we've gone through that bit already. The bad breath, there are 2 areas in the oral pharynx that can give you that, okay? Like we're looking at this, what do you call it, this posture right here,
Yeah.
the fluid in there
Yeah.
is pus.
It's pus.
Yeah, if you have a chronic sinus, where's my pointer? I don't know if I can point it.
Yeah. Yeah. Sure.
If you have, oh, not on the screen, here, but not on the screen.
Right.
Okay. So if you have that yellow part out there on the, this is the left side,
Right.
it's chronic sinusitis that has created pus that is stuck in the maxillary sinus.
So on a
So
normal day,
if
it's
you're
not supposed to
breathing,
be.
no, it's supposed to be
It's
as
supposed to be
empty as this.
empty.
Yeah,
Oh.
it's full of air.
Oh.
So if it gets full of pus is offensive. Listen, like get what
Yeah,
the
the
discharge you get
smell.
from a boil.
Yeah.
It's offensive. So if it stays in there for so long, like I said, the sinuses are all connected to the nose. So when you're breathing in or breathing out, the air goes in and comes back out.
So you can feel it.
So what is sitting in the sinus, like the fluid or the pus that I'm talking about, it communicates with the nasal cavity, so there's something. The second part is what we'll talk about probably next week, chronic tonsillitis.
That's another topic. So,
So
wait,
those are the
when
two
the pus
typical
is
things.
filled in that area,
Yeah.
right? And say this person that
Gives you bad breath.
Yeah, is experiencing bad breath or can even smell,
Yeah.
you know, that foul smell. What's the procedure for that? Is it like a medication that should be given to probably dry it up, or they have to suck it up?
We'll have to go for it. We'll have to drain it. Okay. You could do endoscopic sinus surgery, go in and work on that, get it out. You could do an antrum puncture.
Doc, you know you can stand up, right?
Oh, okay, that's fine. That's fine. Okay,
Yeah.
that's good. I have a good diagram here. So here we are. This one here, unfortunately, is opening up through the cavity there. So once you have the pus sitting here, it's kind of stuck, like this one here.
So that's the pus there.
This is pus sitting here. So what we can do, go in endoscopically, go there, put a suction machine and get it out, or do an antrum puncture, get a trocar and cannula,
Put it
enter
inside,
here, and
then
then
suck
drain
it
it out, wash it out, drain it out, so you free the cavity once again.
So wait, you
So it's an antrum puncture you can do.
endoscopic.
Endoscopic sinus surgery.
Oh, I know endoscopy. I know endoscopy.
Thank you very much.
endoscopy, but I never thought you would have to put.
Oh yeah, you can do
Endoscopy goes
yeah,
anywhere.
Functional endoscopic sinus surgery.
I thought
so
it was
you go
only
in through
the
there.
stomach that it goes.
Oh yeah, you could do that. Laparoscopic,
Yeah.
surgery or that. So you could do that endoscopic here, go in as well. So there's no external cut.
So that's a little camera, like you
Yeah. It's a scope. You go in right there, you're seeing everything.
Yeah,
So you're
and then put
directing your
inside.
equipment right in there. So you can get right there, get suction down and evacuate it. Otherwise,
I'm
just
trying to
go.
touch my face, you know.
Yeah, there you
Trying
go.
to
I know you
understand,
feel it.
yeah, trying to understand how
you feel it. So that can
how
give you
can
that
even
condition.
go there.
Yeah, we know where to pass. So who know? I mean, but that's the direction I've given you.
Yes.
If it's from the endoscopy, go through the natural opening and then get through it. If it's creating a fence, a window down there, then you can go through the what do you call it, antrum puncture, put a trocar and cannula into the antrum, drain it, and possibly create a window there so that pus doesn't collect there anymore, which you call an antrostomy or fenestration.
Right. So all this that we're talking about, it still has to do with the sinus.
With the sinus, exactly. Paranasal sinus. Typically,
Wow.
in this case, it's typically the maxillary sinuses. These ones
Yeah, those
here.
big ones on the side.
They are the typical ones that create this issue. On the frontal area, you can get a ostium or the opening also choking so much, it creates another condition like a mucosal because it's not draining anymore. The secretions all collect, and it can collect and become so hefty, it creates pressure even on the forehead. So you can see a bulge. That's a mucosal. You have to go in and drain it.
Here.
Right at the frontal. But if it's for chronic sinusitis, it's typically the biggest of them or the maxillary sinus that we're seeing here, clearly seeing right here.
Wow, it's actually amazing how we see the nose in one spot. That's in the middle of our face.
Yeah, and that's what we see.
Yeah, that's what we see.
Exactly.
But with the diagram, obviously, we can see that it's
You
not
have
just
the
here. It's
connections,
all the way.
the paranasal
Yeah,
sinuses.
all the way around the
their
face.
nose, yeah.
But now let's talk about the sinusitis.
Sinusitis. Thank you. Okay,
Oh
let me
my
help
God.
you. Sinus and sitis. Sinusitis.
Sinusitis.
Thank you.
So let's talk about the sinusitis again.
Yes.
Are there some home remedies that people can actually use to relieve their sinus?
Yeah. People are doing all kinds of things. People are inhaling all kinds of things, you know.
But is it
all
safe?
those. No, it's not. I will go in with. I know it's bacterial, so I'll go with antibiotics, and give you analgesics for pain. Okay, so inhaling steam, which you were doing during COVID, everybody was inhaling. Neem trees were all finished in Accra because they were boiling and inhaling. All kinds of concoctions. All right. So if it comes to herbal homemade medicines, you have no idea what people do.
Yeah.
Okay.
Because you don't also know the limits of what you're taking.
I will put in antibiotics and painkillers and treat your sinusitis.
So, but at what point do you realize that, okay, you know what, I need to be prescribed some antibiotics?
Oh, the nose is running, purulent discharge, pus is flowing out of your nostrils, you're inhaling steam, you're drinking hot tea, you're eating chicken soup, the nose is still running. Hey, you need to take care of the cause of it. It's bacterial. So let's get antibiotics in. You can do swab, culture, sensitivity, all that, but we know, broad spectrum antibiotics. Hit you with that, and your nose dries up.
Right.
So you need to get treated.
Okay.
And you're not walking into the pharmacy to go and get. You don't know what to get. So at least get it treated, get it diagnosed, and then well treated. Sinusitis is very easily treatable.
Right. We know children are very delicate, but now, how do sinus conditions actually present in children?
Yeah, kids, the sinuses develop much later for some of them. But then for most of them, it's the ethmoidal sinus that create trouble. You can have a kid who has a cold, the next thing you know, the lower eyelid is popped out.
Under.
It's pushed into the ethmoidal sinuses.
Oh, okay.
So that manifests most for the kids.
Right.
And you see the lower eyelid swollen. What's going on? It's an ethmoidal sinusitis. Okay, which must be appropriately treated. So that happens typically for kids.
All right. Can drinking water help clear your sinuses?
No. It's going into your stomach. I'm sorry.
I know it's not meant to be
If you're
funny,
drinking,
but the way you answer.
If you're drinking, it's going in your stomach.
Right.
But if you're using it for irrigation, which I hardly do, because you can choke.
Irrigation like the nose?
Some people get water and try to inhale.
Oh, yeah.
Inhale and hold.
For it to come out from the other side.
Yeah, try to hold and then bring it back out. If you're using the water, drinking water for that irrigation purpose, fine. But I hardly do that. Okay, because you're not going into the sinus and coming back out. It's just in the nasal cavity.
Right.
The water.
Yeah.
Yeah, and if you push it into the cavity, it's stuck there, it's not coming out.
What about humidifiers?
Humidifiers is
Do they actually help?
It's gaseous, you can inhale.
But
you can inhale.
Does it help you?
Yes, I mean, if you get menthol,
Right.
if you get menthol, sometimes you do inhalation.
Yeah.
If you get menthol and you put it in hot water, cover and inhale, it gives you that soothing effect. That can help.
Okay.
If you put in Chinese rub, I don't know what result you get because it's hot. If you put in...
What about ginger?
Yeah, so ginger, people have it in their mouths all the time.
Right.
It burns the pigments and everything, so supposedly helping.
Right.
If it does actually help, fine.
But
that's the main ingredient of the herbal or homemade medication.
Right.
Ginger.
Yeah. So, Doc, for people who have had COVID, right?
Yes.
COVID-19, in the past, we've heard that there's something called long-term COVID and short-term COVID. Has COVID-19 actually changed the way people understand, the loss of smell and the sinus health?
Yes, it has. But I must say again that for most people, it was just a temporary symptom. Okay, I've had a few people who said they had it and it persisted for a long time. But usually for the COVID period, it was a temporary kind of thing, short period. Once you get it over, get the treatment done, the smell comes back again to normal. So it may be other causes that makes it so permanent.
Okay.
And that affects your smell.
All right, Doc, what's the tip of the day?
The tip of the day, here we are. We should once again pay attention to our environment. Don't get unnecessarily abused with irritants and allergens because your sense of smell is also very, very important.
Right. Thank you so much, Doc. How can people reach out to you?
Yes, so you can find I'm working with the Rosbeck Ear, Nose and Throat Clinic, located on Trinity Avenue, directly opposite the Chartered Institute of Bankers, and co-located with Pamoni Clothing The number is to call 0244-380-802, 0244-380-802, 054-772-2195. Last one again, 054-772-2195.
All right.
Thank you very much.
Thank you. Ladies and gentlemen, so we've been speaking to the doctor in the house, who is Brigadier General Dr. Ni Obodai, and he is the director, the medical director of Roseburg ENT Clinic at East Legon here in Accra. Thank you for joining us, and also thank you for sending in your messages. For the messages that we didn't read, of course, you know we will get to read it next week. So see you next week right here, same time. Bye.